Hi, friends, and welcome
Hello.
to an episode of Darling Bish Hour.
Darling Bish Hour. We're here.
Yay.
We're here.
And that beautiful voice you hear is Miss Amy Phillips, the incomparable, the beautiful, the amazing Amy
And of
Phillips.
course, Melissa Reich, Your Bish Therapist. At your service, literally.
Oh my gosh. Reporting for duty. For those of you listening, we are going to be covering the Lindsay Clancy trial. And I feel an immense amount of pressure to do this right and to do it justice, to not fail her and to give really good information. So I just want to share at the top of the episode a couple of things. Is that number one, there is going to be a trigger warning throughout this entire episode. If you do not know what the Lindsay Clancy trial is, Amy is going to provide some facts and information about that. I am going to speak to the clinical diagnoses of postpartum psychosis. What is that? How does it develop? And we are going to stay away from the gory details. However, there will be talk of suicide, infanticide, and we do have to mention a couple of pieces of things.
Yes.
That will be very triggering. And so that this whole episode right at the top, just going to let people know that.
Yeah.
I respect if you love both of us and this is not for you. We respect that. Got to protect your mental health.
Yeah, protect yourself because it's tough. And, both of us really came together on this because we believe in women's mental health. We believe in supporting women, and we feel that there's a deficit in this area that is beyond measurement. And we believe that this case represents that because it's the worst possible scenario. So with that said, I've had my own experience with having a baby and experiencing postpartum anxiety with intrusive thoughts. And I would like to share a little bit about that. And Melissa has a lot of information and has a lot of really great things to point out because it should be educational. We should be learning more about this. And so basically, this is kind of what that is. It's like we want to lay the foundation, Melissa's going to, about postpartum psychosis. And specifically, we will get into a little bit about Lindsay Clancy's experience and allegedly what her story is, and so on and so forth. So with that said, is that a good enough intro, Melissa?
I think that's a great intro. And here's the thing. Do not give yourself short shrift, Amy, because your experience with this, when you told me about it, I was really touched. And I was, we were able to have some conversations and I was able to share some things that you weren't aware of. And so I think that your experience here is truly invaluable because the thing is, and what I want to let the audience know is that I did my homework here. I looked up what the top experts are saying. I did my research. I looked in the DSM. I did all the things because I do not want to be speaking about this carelessly or without the knowledge. But I will say that this requires expertise. Postpartum psychosis requires, there is not a lot of knowledge about it, especially in the mental health field, for example. And so I think that for us, to your point, we're going to be talking about what are some of the gaps that we're seeing on a macro level? What are some of the gaps we're seeing at a micro level?
Yeah.
How did this happen? And what do women need to be aware, to be informed, to protect themselves and their families? And that's really, I think, what we're going to talk about today, which includes a lot of resources too, right? Because when we're talking about something really serious, we want to make sure we give everyone the resources that they need. So, Amy, do you want to start out sharing a little bit of your story and then we can go from there?
Absolutely. So when I had my beautiful baby daughter, I had a great pregnancy other than the hyperemesis gravidarum, which is extreme, morning sickness. It's like a next level of that. But other than that, it was great.
But by the way, that is very serious. Amy's downplaying this. It's not just severe morning sickness. It's like you cannot stop throwing up.
No, you can't.
It is.
Yeah, you have to have like a lot of intervention, medical intervention at times.
Right.
And mine did stop. Like it actually stopped around 6 months, which thank God it did. Because it doesn't stop for everybody. So anyway, I had an emergency C-section. And after labor and delivery, I went home and everything was seemingly normal. I didn't experience anything out of the ordinary until I would say 4 weeks in, maybe 3.5 to 4 weeks in, because my mom stayed with us for 2 weeks. So it wasn't when she was there. And so I'm just trying to do the math in my head because it's been a really long time since I've even thought about this and really like thought about when and how long this lasted. But what ended up happening was I didn't feel depressed. I felt anxiety about something happening to my baby, which I think a lot of mothers do, whether you even have a postpartum anxiety situation. I think you just feel like scared. Like, so when I would go out and take her for a walk like every day, and I lived in like a very, very busy area of Los Angeles, like little city area. So when I'd have to walk across a street in order to get to a more neighborly area that was more calmed down, where there weren't a lot of cars. So there was one street that I had to walk across at the light. And every time I would like literally be having such a panic attack that I just visualize a car coming up and hitting us every time. And I would just run across the street as fast as I can. I probably look like a crazy person. And then I'd get over there and my heart would be beating so fast and I'd be just really terrified. Okay. So that was just like a little thing. Okay. Not that big of a deal. And I didn't even think about that, to be honest with you. The thing that ended up happening to me was I was putting the dishes away. And when I picked up a knife, I my hand felt tingly. I threw it in the drawer and I was like, oh my God, like what was that? Why am I feeling scared about having a knife in my hand? Why do I feel completely weird in my body? And oh my God, my baby's right there. What if I did something with this knife? What would happen if this knife flew out of my hand? What if I can't be trustworthy as a mother? Why did I feel this way? This was a feeling I had never experienced in my life. And it was weird because it wasn't like that. It wasn't black or white either. So I just like would quickly put the dishes away and like walk away. So that was it. But every time I would put the dishes away, that would happen. Whenever I would touch the utensils or the knives, every single time that would happen. And then there were other times when I would feel like I was making the bed and I had like a pillow in my hand. And I'm sure you understand where I'm going with this. Yes. I got to move this pillow out of my hand. I can't be trusted. Like, what if, And those were the two things. So at that time, I didn't have like a therapist in my realm because I like hadn't found one in LA and I'd been here for a long time, but I had one from a really long time ago when I lived in Detroit and Chicago. So I called her up and I was like, I had a baby and I'd love to talk to you about it. I didn't say it was an emergency. I just said, I'd love to reconnect because I didn't know how to, I was scared to say what I wanted to say.
Right. I imagine you were scared because of stigma, right? Which this is very important to what we're talking about today. Women get scared that they have those thoughts and then they feel that they're going to be judged or people are going to be scared or overreact.
Of course.
So you keep it to yourself. And then the second thing is, how do you even have the words to describe something you're experiencing that you don't know what it is?
Right.
Right. When you and I talked about it and I said, this is what that is, you said, oh my God, I never even knew. But until you talked to a professional, when you contacted her, you didn't know that this could be an emergency. You didn't even know how to explain it. And so I just want to give you and all the other moms out there credit that it's hard to describe something that you're not sure what is. And that stigma really, really can make us scared to talk. Yes. Which is the opposite of what we need to do. We need to talk to a trusted person, not someone who has a bad track record, who we're not sure if they can't help us. We need to say, who is this person I trust? And absolutely go to them. So when you emailed the therapist, did she get back to you?
Yeah, we had a conversation and I didn't tell her the first time we talked. I chickened out.
Which that totally happens. That completely happens.
And I didn't tell Brett and I didn't tell anybody because I was afraid that maybe my child would be taken away.
Of course.
Yep. And I've never heard of this. I didn't even want to Google it because I was scared of a Google record or what I would find. I didn't know. And I've never heard, I've never been taught about postpartum, anything other than the word postpartum depression. You're depressed, you're sad, you can't stop crying. I didn't have that. I was elated. I was stressed out. I was like, there were plenty of other things, but like, it was not, I wasn't like, I can't get out of bed. It was nothing like that. That's why this was so scary. So I called her back again and I said, I do need to talk to you. I need to talk more to you. So I got back on with her pretty quickly after that. And I said, I wasn't honest with you. And this is what's going on. And she said, okay, don't worry. I'm not going to call CPS.
Great.
Don't worry. This is postpartum. This is postpartum. This is postpartum. This is what you're having. And she called it postpartum anxiety. She didn't use the word intrusive thoughts because, and so you're the one who said that to me.
Yes, I did. Because that's what you were having.
Yeah, that makes so much sense.
So I want to explain a little bit that one important factor here is that not everyone who has a baby experiences postpartum mental health issues per se, right? Having a baby and being postpartum, so the term postpartum is the period after childbirth. And now we call the fourth trimester, which is considered the 14-week period following giving birth. And the fourth trimester is when women need the most amount of help and receive the least amount of care.
Wow.
So while not everybody has postpartum mental health issues per se, what naturally happens is some level of anxiety. You know, you grow a human, you make a human, you become a new human between the hormones and the body shifts and literally everything changes.
That is such a great point. I love when you said that. When you make a human, you become a new human. And it's true. You change emotionally, like you said, hormonally. You don't realize how much hormones affect who you become and who you may not recognize anymore. And I think that's what's so dangerous about it.
Yes. And then you add into that lack of sleep, which lack of sleep will lead anybody to struggle, period. But then if you have these pieces of anxiety or intrusive thoughts, and then it's lack of sleep, and depending on your level of support, this is why every woman's situation is unique. Every situation is nuanced, but they all require care and attention. And so what I shared with you is that there's postpartum anxiety, there's postpartum depression, there's postpartum psychosis, which is much, much more rare. Postpartum depression happens to 1 in 8 women, whereas postpartum psychosis only happens in 1 to 2 of every 1,000 births. Okay. So it gives you an idea of while postpartum depression and anxiety is common, not all women experience it, number one. And number two, the intrusive thoughts. So I'm going to use what you vulnerably shared as an example, by the way. An intrusive thought is an unwanted, distressing, and repeated image, urge, or idea that sticks in the mind and triggers intense fear or anxiety. And what happens is those can lead to repetitive coping actions that are called compulsions. So it seems like you did not get to this level. But for example, the common theme of some of these intrusive thoughts is harm and violence, which is unwanted urges or mental image about hurting yourself or other people. Taboo topics like forbidden or blasphemous or sexual thoughts that go against your personal values, contamination, which is germs and stuff, and then the responsibility and doubt, which is like forgot to lock the door, did I turn off the stove, that sort of thing. But what happens uniquely for women after they have children is all of a sudden you're responsible for keeping this little thing alive. There's no manual on how to do it. It's you and the people you have around you. And so it also makes sense to me that when your mom was there, it didn't happen because you had that really trusted support. It was when she left that you started to have that issue.
Wow. Oh my God. I didn't even put that together.
Because you probably felt so much safer with her there.
Wow.
And then when you're gone, you're like, oh, this is just me.
Right.
And what if I accidentally fling this knife and it, go, or what if I accidentally put this pillow? And so I'm not going to complete the thoughts because we know where that's going. And I just want to be really mindful. But the key thing with these intrusive thoughts is that they are ego dystonic, meaning that's a fancy word. You'll see it all over the internet. Ego dystonic means it's the opposite of what you want. So you cared about baby daughter so much that it's okay. Take a minute.
That's very helpful. Thank you for saying that.
Yeah. You loved her so much that it was actually the opposite of what you wanted to happen. You were so focused on keeping her safe
Wow,
that
that's very cool.
you had those opposite thoughts. And that I hope all the other mothers listening to this are like, damn, I hope this helps, because with postpartum psychosis or postpartum issues, women women do not want to hurt yourself or your child.
No,
And it's
right.
so scary that it can lead your brain to do some of these things, if
That's
that
crazy.
makes sense.
It's crazy. By the way, I do want to mention that, I don't really remember what my former therapist said. I think it was something like, if it gets worse, call your primary doctor or go to the hospital. Or I think it was, not necessarily even call her, like go get actual help at the doctor or something. Which I never did because it went away. And I think it went away when I stopped breastfeeding.
Oh, isn't that interesting? Because that, right, whether you breastfeed or you don't, that has unique changes to your body and your brain and things like that. So that's very interesting. But also, let me ask you a question. When you talked about it, did it lessen? Or did it continue that way?
It had to have lessened, because after I talked to her, I did not see an uptick in my feelings or my thoughts.
Right.
And then they just dissipated.
Right. Because usually what will happen, anxiety thrives when you're holding in secrets. Thrives.
Oh my God. Wow.
So just by telling our truths to someone, an empathetic witness who's trusted individual, that alone can assuage some of the anxiety. Now, for some, you need more than that. For some, there's medication, there's consistent therapy, there's different things that some might need.
I do think that it would have been helpful for me to go on medication at that time, because I ended up going on medication later in life, and I wish I had had it sooner. And I know you're going to get to this later, but I want to point out that perhaps, and maybe you can address this, is it because I had underlying mental health in terms of anxiety underlying that's why I had intrusive thoughts, why I had postpartum anxiety? Is that because I already had a baseline there, which was never dealt with?
Yes, that absolutely could be, because one of the things with developing postpartum anxiety, depression, or mental health issues is if you have a pre-existing mental health condition and that is not being properly treated, having a child can increase that significantly. For example, people with bipolar disorder, if they are undiagnosed prior to giving birth, the research shows that 50% of women are actually diagnosed in the postpartum period because of the uptick of hormones and shifts in sleep schedules and changes. It can lead to bringing those things to the surface, if that makes sense.
It does. And that is what is happening in the Lindsay Clancy trial and what the defense is trying to prove.
And before I move on to that, I just want to thank you for sharing. And I want to say that you're amazing. You're an amazing mom. And I'm so grateful that you're talking about this. I guarantee you're going to get a host of amazing messages from women, because you're amazing and your experience was hard and you got through it. And I'm just really proud of you. And
Thank you for letting me share this. Thank you for not judging me, and for literally after all these years telling me something I did not know. And what a relief it is to just talk about it today. So, this is, I feel so horrible about the Lindsay Clancy trial that's going on, and for the children that were lost here and the families that are suffering. And I keep thinking to myself, I am seeing women and people across all, races, ethnicities, political affiliations come forward and support the education and the awareness about postpartum psychosis. And for that, I can't be upset about. And I hate that we're here in this state like this, meaning in this situation. But I'm very grateful that this is now getting such national and really worldly attention, international attention because of this. And on that note, in other countries, they have very different laws about things of this nature. And it's very sad what we don't have here in the United States. Yeah.
Let me tell you, nearly every developed country guarantees a postpartum home visit within the first week plus 14 weeks of paid maternity leave. The U.S. guarantees neither.
Wow.
Neither. Okay. There is so much happening in this country. I hear people talking about the system failed, Lindsay. Well, there is no system. Women give birth, they have a baby, they get sent home. They don't get checked in on. If they don't have a therapist, they're just home to think about, well, what are these thoughts? I don't know if this is okay. Everything you just said, that is a very typical story.
And don't tell me to go to urgent care.
Right. And it's like, what are they going to do in urgent care? What are they going to do at the ER?
And even
this
if
is
you
a mental health emergency.
And even if you did go, they still will fail you sometimes.
Oh, 1,000%.
Which is, again, what's happening here.
Right. And so one thing I want to say is that, unfortunately, the system that we're experiencing, there's a trickle-down effect from the lack of support that women receive. Like I said, the fourth trimester, they have the most needs and experience the least amount of care. It's like once the baby's born, it's like, go, goodbye. Everyone wants to do everything before the baby's here. And then after the baby's here, it's like, well, forget it. But the one thing that I was saying to you prior to filming is that, to me, the major problem as well is postpartum psychosis is not officially in the DSM.
Right.
So the current DSM is the Diagnostic and Statistics Manual. It's the 5th version and it's TR, text revision. So it's DSM-5 TR. And in the DSM, even though postpartum psychosis is a known issue and it is an absolute medical emergency that requires immediate inpatient hospitalization for this exact reason, it's not known about and there's no research on it because it's not in the DSM.
Wow.
So what I do want to clarify is that even though it does not recognize it as a distinct diagnosis or standalone, it can go under major depressive episode with peripartum onset or under brief psychotic disorder. But my point here is that how on earth can we have a framework to treat this when it's not in the most important manual for psychiatry and psychology?
It doesn't even have its own bullet point. I mean, come on. That's ridiculous.
No. And here's the thing. The information is out there, for you to look at. But what happens is when you go to a doctor that sees 200 people or doesn't have time to research or do the work or coordinate care with other folks, that's another gap in terms of how this happened. So do you want me to start out talking a little bit about postpartum psychosis specifically?
Yes,
okay.
Specifically, and what those signs are, what the symptoms can be.
Okay. So it is, as I mentioned, an absolute medical emergency. It is literally like, I'm going to compare this to having a brain bleed. If you have a brain bleed.
Or a heart attack.
Or a heart attack or a stroke.
Right. Anything like that.
Anything like that. It is the same thing. The problem with mental health is that it's not as tangible as, like, I have cancer, for example, right? This is as much of a crisis as cancer or anything else, but you can't touch it. You can't feel it. It's hard to see. Like, when you're sick, you can have a droopy face. If you have a stroke, something like that, these mental health issues, that's why they're easy to miss if you're not in front of people who are capable or competent. So I just want to be clear about that. The thing with postpartum psychosis is it has a sudden rapid onset within 2 days to 2 weeks of giving birth. However, the scary thing is it can also occur up to a year postpartum. However, the good news, and this is what I want to say, the good news is with prompt treatment and proper support, symptoms will remit and women will fully recover. That is why this trial is so sad, because it didn't need to get to this point.
Right.
But I'm hoping that because of this, our policies and procedures, and I do hope that this changes, this not being in the DSM. I hope that the powers that be, they look at this case and they say, we need to address this.
That's a great point.
Those things are all possible.
And
if I have any,
if you have anything to do with it,
I will.
And you will. And on that note, that things will change legally in our legal system. Because, for example, in other countries, they do have, if there is infanticide, if it's within 1 year of the birth, your sentence will then be not first-degree murder and you go to prison. It will be under a different category, and then you go into a mental health facility.
Right.
Whereas here, that's not the case. And that is not the case with the Lindsay Clancy trial, because the prosecution is not trying to accuse her of something that they know that she was insane for in that moment.
Mm-hmm.
They're trying to put her behind bars, saying that she premeditatively did this and that she planned it. So that is where we're at right now. And so I just wanted to say that I hope that the legalities will change around that too, because they've wasted a lot of time. However, and I want to say just yesterday morning on day 6 of the trial, something very important happened before the trial really began and the jury came in. Lindsay Clancy gave up they had like a stipulation trial where she agreed to give up any rights about the DNA, blood, urine, any facts about what happened and how the crimes happened. She is not disputing those so that they don't have to waste any time going through 15 more people talking about how we got here. So now they can move into the mental aspect of why it is. So
no one's disputing that she did this. No one's disputing that this happened. But what we are looking at is she was in a mental health crisis that led her to do something while she was in a psychotic episode. And here's the thing, I've worked with people who are in psychotic episodes. I've worked with people who are suicidal. And what I can tell you about that is that if you've never seen someone in a psychotic episode, it is jarring. It is jarring to watch that this person is so far away from our shared reality. It is scary and it is sad and it's a lot of things. But what it isn't is a cold, calculated murder. You know, I understand that this comes with a lot of anger and vitriol. But I think that unfortunately women, especially this prosecutor, women are so happy to just be so hard on women about things. Like, I guess what I'm saying here is that Lindsay Clancy, it doesn't matter what happens, what the verdict is, because this will torture her for the rest of her life. She's going to be living a life sentence of grief and guilt.
She's still suicidal to this day.
Sure. Because how could you not be?
Right. Exactly.
And I think that for me is what differentiates people who are cold, calculated murderers from an otherwise good person who was sick and experiencing a mental health emergency. To me, that's the difference. She's not trying to say, let's do all this DNA checking or I didn't do it's not that. And when you ask her how she feels, she says horrified. She's horrified and still is struggling with that suicidal ideation. So the symptoms that I want to note, because for everyone listening to this that also just heard Amy share, I cannot emphasize enough. If you are scared, you have to tell a trusted person, because that is the only way that we have good outcomes, not just for the baby, for the mom. It's like, y'all deserve so much better than you get. You really do. So one of the major symptoms, especially in this case, is called command hallucinations. And what a command hallucination is, it's hearing a voice instructing them to do something immediately. And there's different types of hallucinations. So there's auditory, where you hear things as she did. She heard commands to hurt her children and herself. You can also have visual hallucinations, so you see things that aren't there. Olfactory, smelling things that are not real. Tactile, feeling things on your skin, like bugs crawling under your skin, things like that, that's not real. And it's called gustatory, which is a perceiving a strange taste in the mouth.
Wow.
So I think that helps people to understand that, like, these delusions feel so real. Hallucinations and delusions, that becomes your reality.
Yes, I was watching a testimony about a woman who experienced postpartum psychosis. She came out and posted her story on Facebook about a week ago after the Lindsay Clancy trial began, because she felt moved to do so and try to normalize this. And she experienced it. She did get the help that she needed, and she was able to level out fine, and she's doing great. She explained exactly what you just said. She was seeing figures walking by, She thought it was her husband.
Yep.
She was seeing these shadows coming by. She finally accepted that as her everyday life. She started hearing the auditory hallucinations, like you said. And she said it was like, not like a voice in your head. It was as if you're hearing the vibration of a voice come in. And that floored me. Because you think about someone hearing voices, you're like, oh, it's in your head. Well, but I mean, it's you are actually sensing, feeling like you're hearing something. And I just never understood it like that.
Yes, it is so biological. And when you're watching someone in that space, it is literally they're hearing it in their ears, a vibration like someone else is talking to them. It's not like with OCD, for example, with intrusive thoughts and OCD, people with OCD can understand the shared reality and know that those intrusive thoughts are in their brain and that they don't want to do it. People with psychosis do not have that same differentiation. They think what is happening is real, the delusions, the hallucinations, they think it is real, and they do not have the ability to get themselves out of that space. That is why this is a psychiatric emergency. So the delusions are a false fixed belief that someone is trying to harm them or their child. And so, for example, like when a lot of new moms with postpartum psychosis, they get delusions or false beliefs frequently involving their newborn. For example, that they need to end their children's lives to protect them from Satan.
Like Andrea
is an example
Yates.
of that. Yes, like Andrea Yates. That's a great example. Then the other major red flag, there's a couple of significant ones, but command hallucinations, delusions, and then the other major red flag is confusion about what is real. This is a huge, huge, huge red flag. And this is one of the things that in her journals, she said that. She's like, I don't know. I'm confused. I don't know what's real and what's not. When you're trying to see if someone is oriented to our shared reality, clinically, you look for, are they oriented to person, place, and time? Now, what that means is, do they know who they are? Do they know where they are? And do they know the proper time of day, year, who the president is, things like that, right? People in these psychotic episodes are unable to be oriented, which is again why it is a medical emergency. There's no like talking to someone that's going to change this fixed delusion. There's no talking to someone that's going to get this hallucination away. They need inpatient medical treatment, and that is primarily why. There's also paranoia, agitation, rapidly changing mood. So it's kind of almost like a bipolar disorder. Like the one feature of postpartum psychosis that is really important is disordered mood. So you may go from really high to really low. And when you're having kind of this manic space, that is also what leads to the sleep deprivation and the insomnia, because your body physiologically is creating this mania that is leading you to be unable to sleep.
Oh. It's keeping you awake because your thoughts are going so quickly that it's overtaking your ability to, I guess I don't understand like why it would keep you up. It's because you can't rest. Your brain isn't resting. What is it?
Yes. So a manic episode for someone who has bipolar disorder is their body is physiologically unable to, like, all the things that those, the things in your brain that tell you that it's time to sleep, the circadian rhythms, all of that, completely taken over by this disorder.
Wow.
Completely taken over.
Wow. Okay.
And that's the other thing. It's like, okay, so you're having insomnia, but you just had a child. So this is a symptom that it's hard to assess or it gets missed because it's like, who's sleeping with a newborn?
And I mean, you had mentioned the diary. She was literally journaling about her experience not feeling like herself, the guilt that she had about her newborn, about sleep training, how she doesn't have, she was documenting everything. She wasn't herself. She wants to get back to normal. And if you're not following this, she was a labor and delivery nurse for a very long, she studied, and I think she was a nurse at this one hospital for like 3 years. I don't know how long she was actually officially a nurse, but if it gives anybody any idea about how much she loved her job, which has become very clear, she named her firstborn child after the baby that she helped deliver. Like
God, that breaks my heart.
She really, the way that, when you paint the picture about who she is, it's not at all who we see her as she was committing these horrific crimes.
Right. Which is another signal that this was mental health driven and not who she was as a person. You don't go from being a labor and delivery nurse who names your first child after, this experience that you had, journals everything, keeps track of things, and then goes and does this.
And now, Melissa, you said that it can it come and go? Because one of the things about this is that, what's the scariest part, is that they keep saying she was fine that day. She took the kids to a doctor appointment. She built a snowman. She called CVS to make sure that they had the prescription. And then it happened.
Yeah. The scariest thing about this all is it can come and go. You can be, and that was the one thing that I was bowled over when I was researching of this, is that you can have a couple of hours where you're kind of your regular self attached to a shared reality. And then literally without warning, that's gone. That is completely gone. And you can come in and out and in and out.
That is so weird. Like, how? I mean, I guess I'm not saying how. It's just, hey, wait a minute. Why? Everything is so complex. But when it's this extreme, it is really hard to swallow. And that's why I understand why people are like, let her rot in prison. And, because people aren't going to take the time to understand what we're doing here. If you're not if you're not obsessed with mental health and you're just busy in your own life and you just don't understand it. But like, that's what's so hard about it, is that all of a sudden this happened. And yet it didn't just happen, because she had been talking about this from September of 2022.
Yes.
And this happened on January 23rd.
And I have some thoughts about that. Because when I was doing some research, I was looking at her med list and I came across something actually really important. But the first thing that I want to say is the causes and the risk factors, because in her case, this is really significant, and really significant for women listening to this, is number one, if you have a history of bipolar disorder or a mood disorder, you have a 1 in 100 risk of developing postpartum psychosis.
Wow.
Now, this paired with a prior history of postpartum psychosis, you jump to 1 in 7 risk. Most cases of postpartum psychosis involve an underlying bipolar or affective mood disorder. And research shows, as I said, 50% of women with bipolar disorder, they're first diagnosed in the postpartum period, because that's when it becomes unmanageable. And then the last thing I'll say is that research shows strong genetic links. So risk increases with family and personal history. So if you have a family history of psychosis, bipolar disorder, mood disorders, you are going to be at greater risk. Why is this important? For Lindsay Clancy, her treatment could have been vastly changed if she was properly diagnosed prior to the incident.
Yeah, that was so, I'm confused about whether or not did she know she was bipolar before that then?
I do not think so. From what I understand, and I could be wrong. When I was looking at her med list and all the things from the trial, is that now she has a diagnosis of bipolar disorder.
Now,
before,
exactly.
It was misdiagnosed. And if it had been properly diagnosed and she could have been properly treated, this whole situation could have been very different.
Yes. And I believe prevented.
I believe prevented as well, because, so let me speak to the psychopharmacology for a minute, which I know this is a little bit intense, but psychopharmacology is really, really vital when it comes to mental health conditions, especially mental health emergencies, especially bipolar disorder, psychotic disorders, things like that. Now, the psychopharmacology says that for postpartum psychosis, antipsychotics, mood stabilizers, and antidepressants are typically prescribed. However, I did a deep dive on this, and I looked at the experts, people who have PhDs, people who work specifically with this, and what they have said is that the research efficacy shows one main medication to be the most impactful, and it was one of the only ones she was not prescribed, and that is lithium.
No kidding.
Yeah.
No kidding. And there were lithium, 13 medications that she was prescribed.
Yes. And I'm going to talk about that for a minute, because
Wow.
Here's the problem with mental health medications is it's a science, but it's trial and error for the most part, right? They have these tests that you can do. I've had one done myself because I've been on Lexapro for a long time. I've managed mental health issues. They do a swab of your cheek and they look at which medications might work best for your metabolism.
Oh, yeah, I did that.
Yeah, they were all
it's
wrong.
Like a mail-in kit. Oh,
mine, my doctor did. My psychiatrist did it.
Oh, okay.
And the one medication that's worked for me, which is Lexapro, was on like the absolutely not one.
No way.
Yeah. And then ones that I tried that did not work. Like Effexor nearly ruined my brain, but it works great for other people. And that was on the yes list. So my point is that there is a lot to be desired in terms of this stuff. So you have to go by clinical presentation. You have to go by clinical experience. You have
trial and error, basically. Right.
Yeah, I mean, essentially. But the wildest thing is that she was on 13 medications, some of which are known to worsen postpartum psychosis. And when I saw this, my jaw dropped. So from September 15th, 2022 to January 23rd, 2023, she was on all these different medications. I can read them if
I would love to hear
anybody cares about that. So
I think you should.
Okay, so it went from, and by the way, like 4 or 5 different providers, which disasters always happen when there's not continuation of care.
Right. And the reason why 4 different providers is because she kept trying to get help for herself.
Correct. But the problem is the providers didn't talk to each other.
Right.
So when I would have someone in my clinical practice and they had suicidal ideation, I would have them sign releases to talk to their physician, to talk to one trusted person in the family that they would allow, because you need everyone to be on the same damn page about what is going on with this human being. A lot of folks will not do that. Whether it's lack of time, whether it's too big of a caseload, whatever it is, if doctors talk to each other, which is rare today, some of this could have been avoided as well. But that's a very good point. So she was on Zoloft, which is an antidepressant, Ativan, anti-anxiety, Benadryl, which is,
Benadryl Benadryl.
Literally.
Yeah, I heard that. Why would it be Benadryl? I don't understand
Here's why.
one.
Some antihistamines, like old school antihistamines, like hydroxyzine and things like that, they were made to be for like antihistamines, but because of the way they work, they can work as anti-anxiety agents because of how they work in your body.
Oh, interesting.
Then it was Ativan, buspirone, trazodone, which is for sleep, Prozac, antidepressant, Ambien, which yikes, no one should ever, Ambien is not good. Remeron, it's an antidepressant and a sleep aid. Klonopin, anti-anxiety. Seroquel, Valium, lots of Valium, which is a benzodiazepine and used for anxiety. There was only one note of a mood stabilizer, and it was once on December 16th, a very low dose of Lamictal. And this is where this is going to come in huge, okay? Then there was Valium, Seroquel. Now, the real problem gets to from January 16th to January 23rd, 2023, she was prescribed amitriptyline, which is a tricyclic antidepressant. If you give a tricyclic antidepressant without a mood stabilizer, it can and will trigger mania and worsen symptoms. Using an activating medication without a mood stabilizer carries significant clinical risk.
Oh my God. Whoa.
And I believe the abrupt changes and inappropriate tapering of the protective mood stabilizers drastically spiked the risk of the acute psychotic relapse.
Holy moly.
Yeah.
Wow. That makes so much sense. January 21st. Yeah.
Yep. And it says specifically antidepressant monotherapy, meaning like, so she kept being prescribed Zoloft and Prozac. Those should be avoided without a mood stabilizer. So basically, she was prescribed a lot of meds without the mood stabilizer that was necessary. And that likely, according to the research that I've done, could be enough to have triggered a psychotic event. Which is
Melissa.
Horrifying.
It's horrifying. Watching this trial, there's so much, but one thing in particular really stood out to me, which was yesterday, day 6. And one of the psychiatrists was speaking on what she prescribed her. And I can't tell you what drugs it was or what drugs she knew about, but she did not find out what she had already been taking. She did not do that. And she said on the stand, why didn't she do that? When the defense asked, she said, because we weren't treating the symptoms that she was being treated for before. That was her excuse.
No.
And I was like, but that defeats the purpose, right? If you're going to treat another symptom, don't you have to know what you're also being treated for and what you're giving? What this person has been given?
Let me be really clear. I am on cancer therapy, immunotherapy. I've been for 6 years. Whenever I take something, I have to have it checked, double checked, triple checked to make sure it is not counterintuitive with my other medications. Mental health medication is the same way. And especially in this scenario, which again, I chalk this up to lack of education, because if it's not in the DSM and psychiatrists don't do the work to look into it, or if they've never treated it, it is easy to look at these symptoms and to prescribe based on, oh, well, you're having trouble sleeping, so let's look at this, or you're having this, let's look at this. A lot of times what's not looked at is the entire picture. You have to conceptualize the whole picture, and it does include what meds you're on. And what also pissed me off is that doctor who came and was like not prepared. You know, Lindsay's lawyer was like, you can't even tell us what was in your note. And she's like, I have too many patients. I didn't look at it. And it was like, to me, here's why that's so significant. Because it's like, if you know you're having to go to court and you're going to the trial of the century and you can't even be prepared for this, I'm sorry, what kind of provider are you actually?
Those were some games that she was playing, and that's for sure. I mean,
this woman's life is on the line. And to play a fucking game like that is it makes me so mad.
Well, see, one of the major points that the prosecution is trying to prove here is that she faked a suicide attempt, that wasn't real. And they're trying to prove that by getting surgeons, nurses, EMTs, everybody on the stand and having them testify what they found, which is that they don't consider her wounds they considered her wounds superficial. They didn't even bandage them up on the scene. They didn't need to treat them when she was in the ER. And so they are really leaning in hard to this. She faked her suicide because this was premeditated. So she faked it. And
Isn't she paralyzed from jumping out the window?
Yes, she is. And
so how is that not...
Exactly.
I'm sorry. I don't mean to laugh. That's insane.
No, it's ridiculous. She had a major spinal injury. She was hypothermic.
She's in a wheelchair for the rest of her life. Yeah.
Had a code blue. She had to have an entire blood transfusion upon being medically flown to another hospital because she was a level trauma patient. And yet they're hanging on to this. Her wounds were superficial. That's what they keep saying. But it's because
the wounds on her arms,
her wrists,
were
and her
superficial.
Neck.
Yes,
and her neck.
Okay,
because it didn't cut through to the ligaments and the muscle. It only was exposing a little bit of fat. So that's why they consider him that. But everything else, they're trying to prove otherwise. So that being said,
that's absurd. That's absurd to me. Because do you know, do you know how hard it would be to slice your own neck?
I don't even.
There are protective factors in our bodies that make it hard to do that. But the fact that she jumped out a window, she is paralyzed for the rest of her life. She was hypothermic. I mean, you can't make that up.
And she had pills, and she crushed up pills in some juice.
Oh, there you go. So you're telling me that this woman tried self-mutilation, pills, and jumping out a window, and you're going to tell me she wasn't serious about her suicidal ideation? That is suicidal ideation with plans, intent, and follow-through, and that is the definition of very serious suicidal ideation. That's wild.
Patrick Clancy, which we haven't spoken about, but I do want to mention that he took the stand. I mean, talk about the trial, really jumping off at the very beginning. They put him on the stand day 1 and day 2. And I think even part of day 3. He said from the beginning, don't blame her. This isn't who she is. His testimony is his testimony. Everybody has opinions on it. I don't necessarily need to get into all that.
Right.
But he failed her, in my opinion.
He failed her very much so.
And I have so many reasons why I just don't understand how when he was smart enough to know, and by the way, his mother was also, I don't know if she worked in, I think she worked in labor and delivery, but she worked at the hospital. Like, I think she was a nurse too. But he's a very intelligent person. He knew well enough to ask her, are you having disturbing thoughts about harming the children? And she said yes. And do you have thoughts about harming the children? And you put her in the
basement? And you put her in the basement alone and you go out to run an errand? I mean, come on. Listen.
And he's remarried and has a child, but that's all beside the point.
No, literally, I was just going to say that too. This man has already moved on, got married, and he has another child, correct?
Yeah.
Already?
You know, yes, he does. And the woman that he married is an IVF doctor. Now, here's the other thing. I can compartmentalize and look at that from a completely different perspective and give him the benefit of the doubt that this is so incomprehensibly horrific that he had to do something drastic and move on with his life.
Sure.
Just a page one rewrite. That I will have to say, I will give him the benefit of the doubt if he had done the right thing when he was with Lindsay. I mean, he divorced her, by the way, you know.
Well, of course.
Yeah.
But
so,
when somebody is suicidal, you need to loop in the family or, again, a trusted individual.
They did have her family come and help out.
Mm-hmm.
But here's the thing. She has said to him time and time again that she had thoughts of harming the kids, and yet he continued to leave her with the children. And he never, why didn't you install cameras? Do you know how many people have security cameras in their home? Why didn't you do that?
Right. Or just do a million other things.
Like, or at the very least, a million other things. There were a few things that he tried to do, which he got his, her family over to help out. He got his mother involved to help her see somebody. She saw like this strange midwife kind of nurse for serious psychosis. She couldn't help her. She moved her on to another person. And also Patrick, after something serious happened, he took her to a postpartum clinic or rehabilitation facility that you and I were talking about earlier.
Yeah.
That's specifically for women who are postpartum or have postpartum depression, like a really nice place, right? He took her there, dropped her off, and then he took his little boy skiing that day. They called him from that rehabilitation facility and said, you have to come pick her up. She's too high acuity for us. She is not postpartum. This is something way more serious than we can handle here.
And they were right.
Mm-hmm.
And they were right. So after that, because from what I understand, so she did that. She went inpatient. She was psychiatrically hospitalized voluntarily.
And that was later after that. Yeah. Right around Christmas.
That was after that. She reached out to suicide crisis hotlines.
Yes.
And because she didn't have a plan.
Right.
Which
they didn't admit her. They didn't have a plan, so they couldn't admit her. Then she went to the hospital and they said the same thing. Then she did ultimately check herself in, and it was around the holidays, so it was a skeleton crew. They made a point of this at the hospital. She was just like doing crossword puzzles and painting and not doing much of anything because no one was around.
Right. And the problem with that is when you go inpatient, it takes a lot of medication management. And there are rules and regs in terms of like to qualify for your insurance to pay for inpatient mental health treatment, you have to have suicidal ideation, which is the thought, with plan and intent. Or with plan. And unfortunately, that is a very broken part of the system. Now, I know every situation is different, and she should have gotten some help either way. I don't know what that would have looked like in her state. I'm not familiar with the, psychological policies in Massachusetts. I'm going to be honest. But it's just, you look, it was failure after failure after failure.
Yeah.
And she's screaming out for help. I mean,
she
it's
kept
just
trying too.
She did.
She kept trying. The reason why she left the hospital after she admitted herself is because she wanted to be home for her daughter's birthday. And then I'm sure once she got home, she's not going to go back. And then why didn't they take her back? None of it makes sense.
Right. And the other thing that's severely lacking here, which I'm going to be honest about, is discharge planning. So when you discharge someone from anything, from a hospital, from outpatient, from inpatient, wherever, you need a plan, a practical plan for how is this person going to maintain this level of health and success at home? Because we know the home environment, you can go back to a lot of things that are not helpful. And that is also, in my opinion, there wasn't a real good risk assessment done for suicide and infanticide. There wasn't any practical difficulties looked at due to her symptomatology. And there wasn't a good treatment plan because she didn't have a real diagnosis.
They sent her back to the first doctor that she went to, who gave her a lot of the wrong medications and didn't make adjustments. And then I think put her back on another kind of medication that wasn't right for her.
I believe fully that tricyclic antidepressant was the nail in the coffin.
Really?
I really do.
Tricyclic antidepressant?
Antidepressant that she was on. I do believe that. I believe it was like, because all mental health issues, if they're, improperly treated, they're going to get worse.
Oh, wow.
That's just a fact.
Really?
It's 1,000%. If it's not properly treated, it's going to get worse.
Wow.
This specifically, again, it's like, I'll use myself as an example. Let's say with my cancer, let's say I tried to take a Benadryl, let's say, for my cancer. I'm a die because that's not the appropriate treatment plan for my cancer. And so with this psychiatric emergency, being on improper medications or not having a mood stabilizer or having them like going off and on, some of these medications take 4 to 6 weeks to work. And when you're being put off and being put on and you're not titrated or all those things, listen, it's easy to be a Monday morning quarterback. I understand there were some people who probably tried to help her, but I just feel like as a whole, she was failed by her husband. Mm-hmm. She was failed by, I would say the system, but there's lack of a system. She was failed by mental health professionals. She was just failed upon failed upon failed. Mm-hmm. And I read a story of a woman similar to what you said before. She had experienced postpartum psychosis, and she said it took her probably 8 treatment providers to get to the right person.
Oh my God. That makes you feel hopeless. But
it does.
Don't stop, don't stop. That's the thing. And I agree. I feel like that is unfortunately the world we live in, to get to where we need to be.
Listen, before both times when I had cancer, I was told I was a hypochondriac. And I know this is not the same. Both times they were literally told me, you're a hypochondriac, go and live your life. And both times it was cancer. So my point is, with very severe medical and physical issues, mental health, physical health issues, unfortunately, the message is you will have to try multiple providers before you get the right one. However, when you do, it will save your life. And it is frustrating, but I'm not going to sugarcoat that. Because unless you know someone or you've worked with them before or you have a referral from someone who you trust, it is very hard to get the person that you need. But there is help available. And so one of the really important things that I want to point out is where to get help.
Yes.
Okay. So first, there is a national maternal mental health hotline.
Oh.
Yes. The number for that is 833-852-6262. And I will post all of this on my social media and on my Patreon.
And send it to your friends who are pregnant and who just had a baby, or just, just to say, if you ever need this, here's this. Because we can share this information.
Exactly. And when we share it, we're less alone. And if that provider can't help us, we can get to somebody else that will be helpful. I saw multiple therapists before I found the one that could really help me. And the ones that I saw before harmed me in a lot of ways. And it's very sad. But unfortunately, you have to persevere and you have to keep trying, which is not fair, but it is, right? Mm-hmm. And we deserve that, right? We deserve that. So the other 2 things, Postpartum Support International is a really great group, and they have a wonderful website. It's www.postpartum.net. But they have a text option where you can text HELP, HELP, to 800-944-4773. I want to kind of have the end message be, you're not alone. You're not crazy. You are important and valuable and worthy, and help is available, and you can get through this.
Yeah. You can tell a friend that you trust. You can tell your partner. Mm-hmm. You can write it in a message and send it to somebody when you're feeling that way. If you don't feel like calling someone, send it in a text in that moment, or send it in a text that it'll automatically send tomorrow at 9 a.m. Help is one step away.
It is. And I will reiterate that anxiety and some of these issues thrive in secret. So you have to say it out loud. You have to tell somebody, especially if there's suicidal ideation in any way, shape, or form. You have to tell someone. And I'm going to be honest. I have major depressive disorder, and during the pandemic, I experienced suicidal ideation, and I had to work with my therapist and my husband, and I was really unsafe, and it was the scariest experience of my life.
Oh my gosh,
my
Melissa.
brain in that moment, I was convinced that I was a burden. I was convinced that this world would be better without me, and there is nothing that anybody could have told me. My husband tried. My therapist, I was like, nope, this is it. My brain, I'm telling you, my brain was different.
Oh
so
my
why
God.
I share this and why I give this as an example is that you have to get people to say, I understand this is what you think, but this is not accurate. This is not in line with our shared reality. This is not it. And you know, and I'm going to be honest, we don't have kids, but my husband, he Velcroed himself to me. I mean,
God
there's
love him for that.
not
That's
necessarily
amazing.
a right way to do it, but he attended to me in every way, shape, and form. And
That's
so,
amazing.
I'm really grateful. And today, I'm going to tell you this too. Today, I am happier than I've ever been. I still have depressive episodes, but the difference is now I do not experience suicidal ideation. There is nothing ever that could happen in my life that would make me feel that that's an option anymore. And that's because I've done a hell of a lot of work.
Yeah, you
I'm
have.
on medication. I have therapy every week. And I just understand my value. And
wow, Melissa. That's so, I'm so glad that you told us that. That means a lot. Thanks for trusting us. And I speak to the darlings, and I speak to the bishes, you know, because I think that, you know, with any experience that we have that is so real, there's hundreds of other people who are experiencing that same thing where they feel like they're in a vacuum. So thank you for sharing that. I know that there are tons of people that are probably listening that, look, it's very common. I'm sure you know.
Super common. Incredibly common.
Yeah. And to see you on the other side of it, and not for nothing, but you did the hard work too, you know,
I did.
Starting from the beginning of speaking your truth.
And that was where my healing started, because for the longest time I internalized it. I wouldn't tell anybody, and it thrived and it thrived and it thrived. And so now part of my healing recovery is whatever comes into my brain, I have to say it out loud. I don't care if it's scary or what people are going to think. I got to tell my trusted people that. And that really does make the difference.
I like that a lot.
And here's what I'll tell you. If I would have ended my life, I would have never done this. Literally, never. I would have never met you. I would have never podcasted. None of y'all would have ever heard my voice. Never. I would have never experienced this. So there is hope and beauty and lovely things on the other side of it. You just got to hang on and get the treatment and get the help.
And just grab a microphone and start talking.
Yeah. You know what I suggest to people? I'm serious. You know, I don't know anyone who likes journaling. I know some people do, and Lindsay, Clancy certainly did. Some people love journaling, but everyone I've ever met hates a journal.
Yeah.
But you know what I suggest? Voice memos. Voice memos.
Oh my God, that's a great idea.
Amazing way to get out the things that are in there, to get it out there. And then you have the recording that you can play for your therapist or your trusted person.
Wow.
And it can give like the tone and the context and all that other stuff. That is one of the most helpful things that I have found. So I will share that with everybody.
And I will share one last thing.
Yes.
I think one of the most helpful for me is just recording myself doing TikTok dances and sending them to people who don't want them. It's very therapeutic, and I'm getting it out there, and I'm dancing my truth. I'm kidding.
You know
I actually don't do
Amy.
TikTok dancing, but
well, dancing is really good for the nervous system. Dancing is actually moving your body is a great way to get out some of those stuck emotions and like a frozen nervous system. Movement is really great.
movement is great. I can even say, like, even during that time when I first had Maddie, I was very active. And I think if I wasn't, it would have been worse. I don't know. I could be wrong, but
to bet.
I think it would, and I didn't even know it at the time, but like thinking back, I'm like, oh, it's a good thing that I was getting my ass outside and doing all this shit and like, and distracting, doing things that like I was passionate about too. Like,
right. Yeah, you got to have those hobbies, those things that make you feel sparks of joy. Like even in my depressive episodes, like recently, I just had one. I hang on and I talk about it until I find those sparks of joy. And when you feel it in your soul, it's like,
so you're saying you got your sparkle bike.
I got my sparkle back, Amy. We all get our sparkle back.
Well, like Brittany says, like she got her sparkle back, but like, and that's in more of a generalized way. But I think the way that you're saying it, which I think is a lot more realistic, is finding your sparkle every time you possibly can when you totally are like flatlined, you can. Just a quick little sparkle. Oh, just a little, there it is. It doesn't have to be like my life has changed. I've got I've had a mommy makeover and now I'm dating somebody. It's not that. It's like,
right.
It's the
this
work
comes from the inner work. Yeah. Now
and
listen, that's great too.
Hey, look, hit me up. I'd love to get a tummy tuck, but like, here's the thing. But every time you can find a little sparkle here and there, that's great.
And savor the spark until it comes back more. Because I'm telling you, when I'm in a depressive episode, I will feel a sparkle of joy for like maybe a minute and then it completely goes away. But I hold on to that for dear life, knowing that more is coming. And it does.
Oh, wow.
Every time.
Wow.
No one ever stays depressed forever. Yes, I promise you.
I think we should do an episode on getting your sparkle back on an everyday basis.
I love that. I think we should,
because
Amy.
You seem to have a real technique there that I am very interested in. So.
Oh, okay. Well, listen, if people are interested in that, hell yeah, let's do it.
Let's do it. I'll get my sparkle back up.
I want to thank you, for, again, your vulnerability and sharing things that like...
Right back at you, sister. Right back at you.
I'm so grateful for this episode. I'm so grateful for the conversation. And I just hope that this episode helps people. And I just hope that the world, we can do some things to help protect women and children and, meet their needs a lot better. That's my hope at the end of the day. So
me too. Well, thanks for listening, everybody.
Yes.
And send this podcast to someone that you think could use it.
That's right. And Amy, please, as always, tell everybody where they can find our most beautiful Amy Phillips.
Not on TikTok doing dances, but I will get there. But
I'm never getting there. I deleted TikTok. I was like, oh, fuck this. I cannot do it. It's just not for me. I try, I fail. I cannot do it.
Well, listen, we don't all need to do it, and that's just fine. But yeah, you can find me. Meet Amy Phillips on Instagram. I'm over on Patreon, patreon.com/dramadarling, and that's ad-free episodes, video, and other things. So
you do so many fun things on your Patreon. So many fun things.
Oh, thank you.
You have like a cooking thing.
Yeah, I just started a cook-along. Dinner with the Darlings.
Oh my God. Yes.
And we had a guest.
Great.
So I'm going to have different guest chefs or cooks. And Mel was my first one. And she's just a darling listener and she loves to cook. So last time I did one, she was like, oh, I love to cook. I do all this. I'm like, want to do the next one? She's like, yup. So I'm going to keep doing that. It's really fun. Yeah,
check out her Patreon because it really is great. You do so many fun things. I also have a Patreon. I do a little bit less than Amy because your girl's been in the weeds. But if you'd like to check that out, I do ad-free. I do full video because people like to watch video. And, there's just a lot of sense of community on the Bish Patreon, which I really, really love and appreciate. We have a lot of darling Bishes who enjoy both of us. And Amy and I'm on our Patreon. We're going to do a darling Bish Zoom.
Yes,
so
we are. We're going to hang out.
If y'all are interested in that, patreon.com/ either Your Bish Therapist or Drama Darling.
Yeah.
Please check us out. And of course, please, if you could be so kind, give us a 5-star review because it really helps and people can be really mean. So with that, we'll just say thank you so much for listening. Thank you, Amy. I adore you.
Thanks, Melissa. Talk to you soon.
TTFN, everybody. Disclaimer. Posts are not intended to diagnose, treat, or provide medical advice. Your Bish Therapist is for entertainment and informational purposes only. The podcast, my opinions, and posts are my own and not associated with past or present employers, any organizations, Bravo TV, Greyheart Productions, or any other television network. The information in YBT podcast and on its social media is provided for general informational purposes only and is not intended to diagnose or treat. Please do not act or refrain from acting based on anything you read, see, or hear on YBT podcast or associated social media. Communicating with YBT via email and or social media does not form a therapeutic alliance. Melissa, operator of YBT, is unable to provide any therapeutic advice, treatment, or feedback.